Hello, everyone, and welcome to the show. I'm Brenda Kilhofer, and I am your Cheap Mama. You're on the Cheap Mama Life, and today I am really excited. We've had such a good time even before starting the interview. I'm excited for you guys to meet Lee Tomlinson. He is the author of the book Compassion Heals: From Self-Care to Healthcare. And before he got into writing, Lee was actually a tennis pro, a successful businessman, very successful marketing genius behind, some Hollywood shows on CBS and things like that. So he has led quite the life and ended up having some circumstances in his life change that led to this book, and is now on a mission to start a compassion project. So we're going to hear about all of that and more from Lee, and we're going to have a great time. So Lee, I'm going to turn it on to you. What else would you like the audience to know about you?
Well, it's very simple. I mean, first of all, thank you for having me. I'm delighted to be here. It is my life mission. And I got to be honest with you. If you had said to me 10, 20, 30, 40 years ago that I would have started a Compassion Heals movement to bring compassion back to healthcare in the world, I would have laughed at you. I mean, it's like, what? I don't even know what compassion means. So that's, what I'm doing now. And all of that stuff before it was great stuff. I mean, I have had a great life. I've traveled the world, playing tennis as a professional, produced award-winning television shows for CBS and the American Film Institute, was an owner of a very famous studio in Hollywood where it's over 100 years old, called Culver Studios, and built Albuquerque Studios. Then I was diagnosed with stage 3, stage 4 throat cancer, which was ridiculous because I never smoked, I never drank, never did anything that would have led to that. My oncologist said it was just bad luck. At the very end of that treatment, when I was at the lowest point imaginable for me in my life, I mean, I was so depressed, in massive amounts of pain. Radiation shot 35 straight days in a row on your throat, aside from the chemo, is like having a cherry bomb explode in your throat. And then the next day doing it again, and the next day doing it again, and the next day doing it again. So I was admitted to a hospital. Hadn't been able to work in a year, running up huge debt. My relationship was on the rocks because I'm kind of a jerk when I'm scared of dying. Didn't know if I'd be able to speak because they may have had to take out my tongue to get all the tumor out. And so now I'm in this hospital. I'm with an infection, with no immune system, dying from cancer, dying from this infection. My life is a mess. If there ever was a time when I could have used just the littlest, tiniest piece of human kindness, just simple stuff, just a hello, just a thank you, just polite. I got zero. I got the exact opposite. These were the meanest, most insensitive, unkind, inhumane humans I had ever met. And I discovered that, I don't know about you, but when I'm at my lowest point, and I'm in a hospital in medical care, those people are gods and goddesses to me. I've trusted them with my life. And if they think I'm not worthy of simple human kindness, they're gods and goddesses. They must be right. The world is a poorer place from me being in it, and I need to get out. So that's when I decided that I was going to end my life. And because I wasn't worthy of living, according to them, put on enough fentanyl patches, go to sleep, not wake up, and my family would collect on a gigantic Keyman life insurance policy at the studio and live like kings and queens for the rest of their life. My final parting gift, what saved me was the day after I got out of the hospital, a doctor friend of mine came to visit. And I managed, very painful to speak at that time, I croaked out all the bad stuff that had happened to me. And before I was able to say, and what I intend to do is to end my life, he did some amazing things. Number one was he sat down, he wasn't towering above me like doctors always do, but he sat down next to me, put his hand on my arm, and he very quietly deeply apologize for the compassion, he used that word, for the compassion I hadn't gotten while being treated.
Wow.
And he didn't have anything to do with it, but he apologized for the medical profession for treating me so poorly. And then he said, but Lee, he said, I have an idea. Why don't you fight and live? And if you're successful, why don't you spend the rest of your life reminding healthcare professionals of the impact of a lack of compassion on your life, and see if you can't remind them of the necessity of being compassionate and start a movement or something. And in that moment, his kindness, that he would take the time and that he believed in me and thought I could make a contribution in the world rather than giving up and dying, saved my life. That conversation took maybe 5 minutes. And it's why I'm alive today. So from then, I formed the Compassion Heals movement, done a couple of hundred keynotes around the world in the last 5 or 6 years, just came out with my book, Compassion Heals, From Self-Care to Healthcare. And we're working on a feature-length documentary, I'm going back to my movie-making past, on the subject of the heart, science, and business of compassion. So it's been a busy few years. I have never been so joyous in my work, despite all those accomplishments and awards and everything else. This is what I was meant to do. And if I hadn't gone through cancer, I would still be doing entertainment stuff. Nothing wrong with that. But it wasn't remotely as fulfilling as the work I'm doing now. So I actually look at my cancer as a gift, not a pleasure, right, but a gift. So that's what I'm up to. And I'm delighted to be here to share it with you and your listeners, and see if we can't remember that the most powerful healing agent on the planet, scientifically proven, is the healing power of kindness and compassion. And it only takes a moment. So that's what I'm up to.
I love your story.
Thank
wow.
you.
And, I think I love that you shared that the cancer was a gift. We all have circumstances in our lives, and we can look at them, as you did initially, as something that had occurred and you were ready to end your life after that battle and the lack of compassion and all of those things. Or we can find a way to reframe. And thank God for that doctor, that your friend that came and sat down with you for those few seconds. What I love is that, it's like you have all of this set of experiences prior to that, people would be like, oh, I'd love to, travel the world as a tennis professional, or, be in business, do Hollywood, all of those things. But all of those really have just paved the way for what has become your purpose. You'd be fumbling probably around now saying, well, how do I do a documentary if you didn't? And you've got that experience and you've got those resources because of all of the experiences in your past.
It's so interesting that you say that. When you have cancer, and your life changes dramatically from the moment you get your diagnosis, it is never the same. And I have to say that as I finished my treatment, I'd lost 60 pounds. I was in excruciating pain. I had a purpose. Didn't know what it meant yet. I haven't started many movements. I can't speak for you, but that was what kept me going. Is that people said, I was like 3 or 4 years out of entertainment. I didn't know if I could speak. I didn't know what my life was going to hold. And people kept saying to me, well, Lee, when one door closes, another door opens. Now, I got to be honest with you, when you're dying of cancer, that's the last thing you want to hear. I wanted to smack these people. And again, I wasn't in a very good mood when I was that sick and in pain. And I didn't pay much attention until somebody said to me, looking at my experience, said, Lee, when one door closes, another door opens. But most of us are so fixated on the door that closed, we never see the doors that are opening.
Wow.
Boy, I got to tell you something. That opened my eyes. And I started to look at this whole cancer experience rather than a curse as a stepping stone into what I'm doing now, which gives me more joy and more pleasure than anything I've ever done in my entire life. So I had to look at it, though, as an opportunity rather than a disaster. I wouldn't wish it on anybody else. There are easier ways to learn, folks. Don't, get to that point. Find out what your purpose is. Find out where your heart leads you, and either do it for a living or do it as your hobby. Either way, but you have to do it because you don't want to be on that deathbed saying, oh, I wish I had. That's the last thing you want to say as your last words. You want to go, I did it all. Some of it worked, some of it didn't. It was a great life. What's next? So that's what I'm going for. What's next?
I just out of curiosity, were there ever before cancer, were there ever just signs or just a questioning that like you somehow knew you weren't living your purpose or that you were not exactly on the right path?
Yes, many. I never quite felt fulfilled, if that's the word. Successful, famous, extraordinary adventures. I have had a great life, and I'm 72, so I've had a lot of time to have them. I actually, God, I have not told many people this. I actually went to college to study to be a Presbyterian minister.
Wow.
Now, that was a couple of 100 years ago. But when I got to college and started along that line, it was very clear to me that established religion with rules and regulations and all of that sort of stuff would not fit me at all. And so I moved out of that. But my desire to be of value to people has always been there. It was the way I was raised, which is treat people like you'd like to be treated. And when the opportunity presents itself, do something for somebody else. And that's just the way I was raised. So I've always looked for opportunities to do that. And, in the entertainment industry, you're pretty much about making content, making money, being famous,
Right.
has not much to do, although some filmmakers do, but it doesn't have, it's more about that than it is about changing the world for the better. Right. So I feel very fortunate to have gotten to where I've gotten because this is what I was looking for growing up. I admired the people who could stand there and talk to me and move me and make me a better person for having heard them. Wanted to be one. It just took 50 years to get there.
I have a girlfriend that says the lesson continues until the lesson is learned. And a lot of times when I feel like I'm not on my path, I'm just like, okay, I guess I better get moving before I do have something major that has, that big wake up call. And so as I was learning about you, I really, there were so many things I could relate to in my own journey. I mean, I'm a mom of 4 kids. I'd had a couple miscarriages along the way. And, it's funny. I live in the West Valley outside of Arizona, outside of Phoenix. So going down, and there's hospitals out in the West Valley, of course. But I had not experienced, in my first couple of kids, I had not experienced the compassion that I had hoped for. I mean, in fact, the one I remember being, in one of the situations, I actually had a broken wrist when I went in because I'd fallen showing houses in my real estate career while I was pregnant.
Dangerous profession, obviously.
Yeah. And so, and so after a season, I couldn't get in and out of bed by myself, and you've got a baby in one hand, a broken wrist in the other, a cast on the other. And And they weren't stopping overnight to visit. And when I kept asking for food, and I know you mentioned in everything that you've talked about how they're overtaxed, and that's part of the problem. So I definitely want to hear about that.
Yes,
And
absolutely.
and just not, being hot and cold and just not getting the help that I needed throughout the night, and being hungry and cranky and irritable and all of those things, and hurting.
Yeah.
And so I think that makes it worse. And then by contrast, we went to a place all the way downtown with during one of the miscarriages, where in this one I actually had to deliver and everything. And the staff was so amazing and so compassionate and so wonderful. The nurses that I had through the night were just unbelievable. So when I had my next child, I'm like, nope, that's where we're going. I don't care how far away it is. I don't care if I end up on the side of the road delivering to get there, but I never wanted to experience what I had before. So tell me how your project is going out and making an impact. And I want to touch on the self-care side of it too, but let's just start with that. How is your project reaching out right now to the medical field and supporting that?
Well, initially, it was me coming and delivering keynote addresses at hospital groups, medical groups, medical conferences of med schools, nursing schools, you name it, I've spoken there all over the world. I've done over 200 keynotes in the last 5 or 6 years. That's some extraordinary groups of people. The vast majority of them are healthcare. So I've been spending an enormous amount of time doing that. My goal has always been to try to reach every healthcare professional in America with my message. But there's 22 million of them. And at some point, at the beginning of COVID, it was very clear, Lee, great goal, not going to happen on stage. I understand you love it, but you got to find other ways to get this message out there to those 22 million and everybody else in the world. There's nobody in America today, there's no human alive that isn't feeling great pain. What is it? Be kind. Everybody's fighting a great battle. And so that's when I realized I got to write a book. So I wrote a book. Then I realized I'm not going to get 22 million books out there either. That's when I realized I need to do a documentary that we can distribute to every man, woman, and child on the face of the planet, presenting the scientific, massive evidence of the healing power of compassion, not only for the receiver, like you experienced, but also for the giver. Both people experience the exact same physical, mental, and emotional benefits given or received. And the, how do I say it? The bottom line, you mentioned you want to go to those people again. Maya Angelou said, people will forget what you say, they'll forget what you do, but they'll never, ever forget how you make them feel.
Right.
And in healthcare, how you feel dramatically impacts your ability to heal, how quickly you heal, the chances of you healing, the amount of pain you feel, the benefits are massive. So it's compassion is the only thing that will get us through the pandemic. We are genetically bred to be compassionate. It was never survival of the strongest, because the dinosaurs will eat you. They don't care how strong you are as a single human. It's survival of the kindest. And that means that the way we managed to survive against all those predators was at some point somebody in a animal skin walked up to somebody else and said, you're going to die tonight when you go to sleep. I'm going to die tonight if I go to sleep. How about this? You go to sleep, I'll stay awake and guard you. Then when I go to sleep, you guard me. That's what got us through the days of the dinosaurs. And that is, in fact, compassion. Take away all the prejudices. When you take a child that's 1, 2, 3, 4, 5 years old, before they've been scarred, if they've been scarred by their upbringing, and you put them in a space with another child who's crying and upset, they will automatically go over to that child and try to help.
Yeah.
Because they feel their pain. They are naturally empathetic and compassionate unless that's squashed by their parents, family, friends, or teachers. So, coming out of COVID, where we've been isolated, we are all upset by the lack of human contact. On phones and media, it's not the same. And so we are all suffering to some degree from that separation. So the opportunity to be kind and compassionate with each other is a way for us to heal our own wounds. If I give to you, you're better for it. And so am I. And it's the best advertising on the face of the planet. You pointed out that clinic, hospital, whatever it was, where you got the care, forget the treatment. Right. Treatment the first time was probably fine. Who knows?
Right. Yeah.
But the care is what will bring you back or not. So that place where you got crappy care, they lost your business.
Yeah.
The one that treated you with kindness and respect and love and all of that, you're going to be there forever. And you're going to tell your friends when they need somebody with those skills, go here, don't go there. So compassion is the gift that keeps on giving. It helps heal the person who receives it, who's in pain for one thing or another. It helps heal the giver who's in pain for one thing or another. And if it happens in a business context, it's great for the bottom line. Why is it, with that all being true, that 50% of Americans today say they receive zero compassion when they go in to get help from somebody in medicine? Zero. The World Health Organization said providing a compassionate environment is essential, mandatory for the best outcomes. And yet, only 50% of patients today get any. That's a crisis, particularly now when people are in such great pain. Forget, medical, just mental, emotional, and spiritual pain, unlike anything I've ever seen in my life. I can't speak for you. And it's not surprising with all that pain that we see more violence, more discrimination, more misogynism, more sexism, more racism than ever I've seen in my lifetime. And I don't know about you, but I'm looking for an answer to all that. And I believe it can be kindness.
Yeah.
Knowing what it does in a hospital setting, knowing every human you come in contact is in pain, your simple contact with them in a kind, loving way, which could be a glance, which could be a smile, it could be opening the door, caring, whatever it is, will help heal them and will help heal you. So the answer isn't to sit alone. The answer is to get out and help. Go to a food kitchen, volunteer at the kennel, whatever. Get yourself in a situation where you can give, and you will never, ever feel better afterwards than having done that.
Oh my gosh, absolutely everything you've just said 10 times. I agree with you. That is, I think one of my biggest frustrations, and it's ironic, you coming from, media, Hollywood, all of those things, a lot of times I feel like, because, it is all of the things you talked about that sells, right? That's what sells the movies. It's what sells the shows. It's what sells the news. That's what sells. And especially with this pandemic and people being, separated, because I've been somebody who kind of unplugged from all that. And with the pandemic, ended up plugging in because I wanted to know what was going on.
Exactly.
I wanted to know what was going on. And then it was like, this is crazy. Like,
yes,
I mean, I could actually see, two completely different agendas being, it was one or the other being shared in everything. Right. And to your point, kindness, that's been one of the things that I've said over and over again. It really is that simple. Right.
It is.
Mean, even if you just want, even if you don't believe in, religion or God or Jesus or anything, even if you just wanted to take Jesus as a historical figure that actually walked the earth and take his basic teaching of love one another.
Yeah.
That's really, it's that simple. It's the solution.
And the truth is that we're taught prejudice. We're taught this group is better than that group. We're taught that. We are not born sexist, misogynistic, racist. You put any word, any IST in there. We're not born that way. So it is an educational process, and hurt people hurt people. When you consider that 85% of people in America today grew up in a dysfunctional childhood, is it any wonder that when they get in the deepest part of their pain, that they pick up a gun and start shooting people in a mall? Nobody who is, first of all, nobody's without problems. Everybody's got pain. But nobody who is in touch with their purpose, pursuing their purpose, leading a meaningful life, ever goes to a mall and starts shooting people. So, not to excuse it, but those people are so damaged and in so much pain. They don't feel seen and heard, and they have rage and anger that if they leave it inside, they will explode. So they start taking it out on others, and hence all of those violent protests, shootings, assaults are up in some places hundreds of %.
Right.
That's why, and it's exacerbated by our loneliness and our disassociation from COVID. It's made even worse. Not to mention any names, but we had an administration that welcomed violence, that encouraged violence, that was highly prejudicial against any number of different groups and made that well known. So those that are damaged and those that have those same beliefs are now have been encouraged to take them out into the world. We got to fight that. Does it sound too simple? It's simple human kindness. I promise you, I know a fellow who leads recovery groups in prison for long-term violent men and women. And gets them together, and over time, when they feel seen, heard, and appreciated, they change dramatically. Dramatically. So even the worst people, all they want is affection. All they want is love. All they want is to be accepted for who they are, damaged like all of us are.
Right.
But they expressed it in more violent ways and were caught doing it. So it works. Scientifically proven. Read a book called Compassionomics. Friends of mine wrote it. They did a 2.5-year study. They're both research scientists and both doctors, about all of the studies done on compassion to find out if it was just a nice thing or if it really did have measurable medical benefits. Without doubt, they went in thinking it didn't. 2.5 years later, they came out 180 degrees in the opposite direction and said, providing compassion in a medical environment, just like the WHO said, is mandatory for the best outcomes in the shortest period of time and the longest term health. So it's now scientifically proven. The question is, are we, whether we're in a hospital setting or not, are we going to take control of this situation and say, I want it to change. I don't want to sit around and just be angry and pissy all the time. I'm willing to do a little something, but what can one person do? Well, let me give you an example. So there's a story about a fellow who was living in San Francisco, and he wrote a suicide note, something I can relate to. And he said, I'm going to walk to the bridge and I'm going to jump. Mm-hmm. Unless one single person makes eye contact with me. What? Eye contact, just a nod, eye contact. They found his body floating in the bay. So however long that walk was to the Golden Gate Bridge, not one single person made eye contact with this human being, and it cost him his life. And how long would that glance have taken? Yeah. A nanosecond. That little bit. Will every single kind act save a life? No. But it might. And it certainly will improve it. And why not? You want to change the world? Start with you. Start being more kind to yourself if you're in great pain. And then once you're not, to others.
It is time for us to take a break. And I want to go down that road with you more.
Good.
What can each of us do? Because I know, you take that story and I just feel like right now, that's magnified, right? How many loved ones were in hospital care and died alone without loved ones around, and maybe didn't have, didn't get the compassion that they needed. How many people, just that kind look takes more effort when you've got masks across your face. It's, the smile doesn't come automatically with it.
Yes. So it's hard. It's hard on a good day without masks. It's hard. And we'll talk about the burnout that impacts healthcare professionals and how that impacts our care in the next segment.
Absolutely. And the biggest piece you brought up was that we're responsible for what we can do. So each one of us can impact that as well. So right after the break, we're going to jump into all of that.
Cool.
Hope you enjoyed that episode of the Cheap Mama Life podcast. Be sure to subscribe, rate, and review right now if you haven't already, and hit that share button. Until next time.
Hey, and welcome back to the show. I'm Brenda Kilhofer, your host. You're on the Cheap Mama Life. And today we have just had a great time so far with Lee Tomlinson. As we left off, we were talking about what each one of us can do to help improve the care and compassion received in healthcare and throughout the world. So I know you have an incredible challenge that you've put out there as well. So hopefully that's one of those ways that we as an audience can support and serve your mission, which is absolutely needed.
Thank you. Well, it's true. When I deliver my keynotes to healthcare audiences, it's information and it's it's presenting the science of it to prove to them that it's not optional. It's absolutely a necessity. We also talk a great deal about burnout, which is pre-COVID, 60% of healthcare workers burn out. And one of the qualities of burnout, or whatever you want to call it, is they become emotionally numb. They're in such horrible pain that they numb themselves one way or another. How is unimportant. And what happens, though, is that when you're emotionally numb, that is the antithesis, the opposite of compassion. If you can't feel empathy, you're not going to see the pain of another, let alone feel it. And you're not going to respond to it. And that's what I realized happened to me in that hospital. I have had a lifetime of medical interventions. I've been hospitalized in 6 different countries. I'm addiction to adrenaline, so it's gotten me in some weird spots. I've broken a dozen bones. I've had my thumb pulled off, skin grafts, bone grafts, infectious diseases, you name it. Through the vast majority of those that I can remember, I was always treated competently and compassionately until this time in this hospital. And at first I thought my job with the Compassion Heals movement was to get those people out of healthcare because they were clearly bad people. Wrong.
Right.
The vast majority of people that I've met, I didn't know about burnout. I knew it in my life because just preceding my diagnosis for cancer, I was the most burned out person you ever met. Absolutely burned out with every single characteristic for burnout. So all of a sudden I went from hating those people, I started having compassion for them. People in healthcare give and give and give and give until they literally burn out and can't do it anymore. And then they hurt themselves. And then because they've shut down emotionally, they start killing us patients by depriving us of the compassion that got them into healthcare in the beginning. So as I'm having these conversations with people in my audiences, that's all great information, how important it is for you. Okay, great. But unless I challenge you to do something to up your game, it's all just information. Compassion requires that we allow ourselves to look deeply inside ourselves and never take our pain out on someone else. That takes introspection and healing. So I say, all right, so your patients could use more kindness and caring. Your family could, your friends could, strangers could, the world could. And unless you commit to being more compassionate for yourself, if you're burned out, or anybody else, unless you commit to doing something, it's all just talk. So if we want to make a material difference in the world, I say, all right, go to my website. I want you to sign up in writing at challenge.leetomlinson.com. challenge.leetomlinson.com and take our Compassion Heals Challenge. And here's all it is. For the next 7 days after you sign up, you agree to consciously and intentionally give one kind act to the world. It can be for you. If you need, to eat dessert first, go ahead. That will be your kind act for the day. If you need a massage and you get it, that's your kind act for the day. If you're in great shape, giving $1 to a homeless, that's your kind act. If it's giving a glance to a complete stranger, like that fellow walking to the bridge, just acknowledging other human beings, that's your kind act for the day. Each one of them takes minutes. You don't have to pay for somebody's tuition. You don't have to buy them a new car. You don't have to pay the mortgage on that. No, if you can, why not? But just any small kind act makes a difference. And the coolest thing of all about this compassion medicine is that when you give it to someone, it has been scientifically proven, there's no opinions in this, that it tends to get passed along. So when you surprise someone by a kind act, they are highly probable to do the same for somebody else, who's highly probable to do the same for someone else and someone else and someone else. So if we want to make a difference in the world, one kind act can ripple through the world. 7 kind acts can ripple through the world. If we have 100,000 people and that's 700,000 kind acts, you think they'll save a life or two? Absolutely. You think it'll improve a life or two? Guaranteed. But we have to take action or we're just going to piss and moan for the rest of our lives. And that is misery. Let's do something to make the world a better place. Let's do something to counteract all that violence and misogynism and sexism. Simple, kind acts. If you're in contact with another human being, they're in pain.
Mhm.
If you can't see something they need, just a glance and a smile will do.
I love that. I did, I not too long ago actually did I had a 6-week goal period that I was working with. And my goal, my contribution goal was 150 or more acts of contribution.
Wow.
And so I actually put a spreadsheet together and, I tracked, and it was, I love how you share that it can sometimes just be the smallest act. And there's so many things that, really when you're walking in your purpose or your passion, that many times just being in that space is spreading that kindness as you go. Because I remember getting into it, because a lot of times you go into that, well, it has to be big, because you're thinking in terms of what other people judge or think, and then there's even the, well, if I get paid for it, well, then that's not really contribution, or if I benefit from it. But you spoke earlier about how both the giver and receiver benefit when we're coming from that place of compassion, and we're giving and receiving. So I would encourage you listeners, please jump on this challenge, because I know for me, it taught me so much about what, one, how simple it was to from a place of contribution, but also to get rid of some of these, negative thinkings around whether, and judgment of myself, the self-judgment of whether it was self-serving or whether it was contribution, because I got to feel,
Exactly. That was my question.
Yeah.
After 150 days or 150 kind acts, regardless of how long it took you, how did you feel?
Well, the incredible thing is I stopped beating myself up a little bit. I stopped beating myself up, and I realized that, because certainly you can go, others beat us up as well. And then you can read, the whole point of this is to help people grow. So I love personal development and growth. So I can pull that hammer out like the next person. And what I began to realize is, all of those folks that have said I'm not compassionate, or I don't care about others, or the times that I've said that, they're full of it, because I realized in tracking that I actually operate from that place a lot of the time.
Yes.
And even more so as I began to track it and be down that journey. So it's life-changing and I don't know, who knows what the receivers, which receivers benefited, which didn't. I'm sure they all did in some way. Some will remember, others won't, but
even if they don't remember it, they felt it in the moment.
Yeah.
It's like putting a little bit of healing medicine on a wound. They don't need to remember it the rest of the life, but in that moment, and maybe for the next hour or two or a day or three, they remembered, oh, wow, that was so cool. And that helps heal that wound. Right. No question about it. Literally scientifically proven, it absolutely does. And not just the physical one that you put it on, but also the mental, emotional, and spiritual ones to say, does anybody even see me? Do I even exist? That's what we crave, is you have value, you have worth. I see you, and I want to connect, if only for a moment. And I'd like to connect with you because that's what I think of you. Mm-hmm. That's powerful stuff.
It is.
That's powerful stuff. So, and it works. And it works. It's so interesting. If you take people who say, I'm not, even the meanest of people, and somehow or other, they were instantly found themselves in a dire situation where someone was injured or drowning or bleeding. People don't walk away. No. Even if it's someone that in their normal life, their learned life that they don't like or don't respect, whether it's somebody who's gay, whether it's somebody of color, whether it's a woman, whatever it is that in their normal life they have negative feelings about. When push comes to shove and someone is in dire danger, very few people will not stop to help.
Right.
Afterwards, they go, I can't believe I saved a fill in the blank.
Mm-hmm.
But that's their learned behavior.
Right.
Their instinctual genetic behavior is, I get the pain of that person drowning. I get the pain of that person in that accident. I get the pain of that lost child. What can I do to help? And they're moved to try. That's what we're trying to get people back to, is that innate goodness, caring, kindness that we've lost in the past 2, 5, 10, 15 years, is to bring it back, especially now when we need it the most. So It's one kind act a day. Challenge.leetomlinson.com. We're not going to sell you information. We're not going to sell you anything. All we want to do is encourage you to do one itty bitty little kind act a day. And then maybe we'll give you another one in 6 months. But you know what I'm saying is, we just want you to know this stuff works. You just got to commit to it, or just sit around and complain the rest of your life. You choose. It is a choice. Compassion is a choice.
Now there's a movie I want to see. All of these kind acts stacked up on one another. Imagine the feel goods there.
Guess what we're going to have a lot of
on your documentary?
In our documentary.
Wonderful.
Is exactly that. Exactly that. And it doesn't get much news. All of the nasty stuff does. Mm-hmm. You know, we want to put something out there that is life affirming, that shows the innate goodness and connectedness of people, even when it goes wrong, how it can be recovered. Those people in that prison, we're going to have people like that. So what was it like to be in a group? You know, you murdered somebody when you were 12. Mm-hmm. You know, how did you go from being this jerk to this kind, loving human being you are now, even though you'll never get out of prison? That's the kind of thing. And it was only human contact. It was only that heart-to-heart intimacy that can do that. So if it can work for them, it can work for the rest of us.
I absolutely believe that. I've seen it work in, countless seminar rooms and things like that. I too know a gentleman who does prison, who takes seminars that he used to do as a facilitator into prisons. I believe it's in Washington State, and has actually decreased the recidivism or whatever. I can never say that word, of them going back in, because they are able to forgive what they've, themselves, others, heal those wounds. And a healthy, happy, fulfilled body and soul, and I'm sure just adds to the science. I believe
Absolutely
that. And
true.
I wish we had, another hour or so, because I'd love to, I'm kind of a nerd and a geek when it comes to that. Would love to hear all of the science that you've shared.
Buy a copy of the book.
I will.
Compassionomics.
Okay.
By Steve Tresniak and Dr. Mazzarelli. It is astounding what they discuss. It's astounding. I just wish they'd written it sooner. I did all the same research to come to my conclusions, to present it, and then they put the book out. It's like, guys, where were you like 4 years ago? You could have saved me 1,000 hours of reading, studies. But they're great guys. I did a podcast with them the other day, and they are astonishingly smart guys. Oh my goodness gracious. And the book they put out, #1 book. You want to know if compassion's real or imaginary? If it has power, read this book.
Awesome. I love that. Before we have a little bit of time for one more subject. The title of your book is Compassion Heals from Self-Care to Healthcare. We've talked a lot about the healthcare. what should the listeners know about self-care? What do you really want people to understand when it comes to that?
Yeah, it is incredibly simple, which is you need to be healthy. If what you want to do is be your best self, if what you want to do is experience joy in your life, if what you want to do is make a difference in other people's lives, you have to be healthy mentally, physically, emotionally, and spiritually. If you have all those issues in your life and are miserable, you got to get to work, get help. I don't care what kind of help. Listen to podcasts, read a book, read 10 books, get psychological help, whatever it is. You need to look at the pain you're experiencing and effectively deal with it so that you can be your most effective, compassionate self. And if you're well enough to be able to actually reach out to others and be kind, great, do it. If you're not, if you're one of those, life sucks and I got a rotten deal and I got cancer and, I got evicted from I get it. It's painful. However, you want to feel better? You want to feel more fulfilled? You want to feel like you mean something in the world? Take care of yourself first, then serve others. Start with you. We say in healthcare, always put the patient first. No, those people in the hospital didn't. They were burned out. You and the people you work for need to prioritize your health first and foremost. Institutions do not pay enough attention to the care, kindness, and compassion their staff is getting, which allows them, and in some cases, encourages them to work so hard that they burn out. So we need people within healthcare and outside to heal themselves first, then decide they're going to do some good in the world and be kind to everybody else. And if you work in an institution that treats you like crap, get out of there. Find some place that values you and your specific gifts and values it, and figure out how to work there, or you will be miserable and in great pain the rest of your life because every day you're getting beaten up. So self-care to healthcare. You want to be healthy? Take care of yourself. You want to take care of yourself and feel really healthy? Give to others. Simple, kind acts. It's the answer to everything that ails you.
Lee, I had a mentor years ago. He's since passed. He wrote a book called The Compassionate Samurai. And as I listened to you, that is absolutely what I heard, a compassionate samurai, as you shared with the audience to essentially put the oxygen mask on themselves first. I could hear the compassion in your heart and in your voice. And I am so grateful to have had you here today. I know that you've blessed me today, and I believe that you're going to bless many, many, many listeners. So thank you so much.
Your lips to God's ears. Thank you for having me. Your comments gave me goosebumps. So that made my month. Thank you for having me.
Thank you for being here. And you're welcome to come back anytime.
Good. Let's do that. Let's have some fun. Let's talk about stuff. And meanwhile, I'm going to go out and do some keynotes in person now, which is very exciting.
Yes, I hear you do it in a hospital gown. I was almost expecting you to show up in one today.
Well, I would have, but given that you didn't expect it, I wasn't so sure. I normally do them. And the reason is that if I'm speaking to any audience, particularly healthcare workers, is I want to remind them that horror that we feel when we're in their presence, they don't even have to be speaking to us. If we're wearing a patient's gown, we're already miserable. So the minute we are in your company, just remember, people wearing these are all miserable because you're going to hurt us or tell us something's going to hurt us or get us ready for something that's going to hurt us. So I do it just to remind them that that's who is paying your bills. We're the ones who are going to suffer, and you can make it miles better by simply being competent and equally compassionate. That's the goal. And hopefully that miserable, I've done it, over 200 keynotes in that stupid gown and with my rear end hanging out. It's after 200, it's still deeply humiliating.
It is.
Works.
We're completely exposed, and
are,
that is in and of itself exposes the wounds that we're feeling inside because of that exposure. Well, thank you so much for being here. Listeners, remember to like, share, and download, and we will see you next time. Thank you again, Lee. Appreciate you.
My pleasure. Be kind, be caring, be compassionate.
Hello, good people out there in podcast world, cyber world. Interrupt your programming real quickly to tell you about our sponsor, Medium Lauren Robbins. Medium Lauren Robbins, if you look at someone who's warm, loving, genuine, and has a welcome energy, like talking to a friend, Lauren is the one to talk to. She's direct. She will tell you what you need to know, not what you want to hear, and will comfort you when you cry or when you are upset, like a good friend would. If you are a new client, she will make you understand what you requested before you even start the session or service. Visit MediumLaurenRobbins.com for sessions and services. Get hooked up with an endorsed medium today.